Assess how the UK's lockdown measures are working. Restrictions in some European countries are starting to ease. A limited number of shops and businesses have been allowed to reopen in Italy and Austria, and some people are beginning to go back to work in Spain. Denmark plans to open some of its schools tomorrow after a month-long shutdown. Well, Martin McKee is Professor of European Health at the London School of Hygiene and Tropical Medicine, and he joins me now. Professor McKee, thanks so much for joining us here on BBC News. I guess the British government will be watching very closely to see what's going on in your other European countries.
Well, I hope they will be. One of the problems that we've had so far is that there has been rather a disconnect between us and the rest of Europe, which is a pity. But it's absolutely imperative that we do learn the lessons as the other countries adopt different policies.
There's been a disconnect. The accepted view is that the UK has lagged behind other European countries by some 2 to 3 weeks, and that's why we are some way behind.
Well, we have to look at the mathematics of the epidemic, or the pandemic, and we know that with a virus that is spread by every one person to typically between 2.5 and 3, let's say 3, the next time round it's 9, then 27, then 81. Even a change of 1 or 2 days makes a huge difference. And when we look at the cross-national comparisons, we can see that those countries that intervened earlier in the pandemic in their own country managed to keep the death rates much lower. So clearly the timing has been absolutely crucial all the way through.
And how important has testing been, or the lack of it?
That is really very well. First of all, it would have been nice to have been in the situation that Germany was, but that's been rehearsed many, many times. I think what the issue now is to make sure that whenever we do move to some loosening of the restrictions, and I think we need to be very careful because what's being done in other countries is still very minimal. It's not going back to what was going on before. But as we move ahead, we need to be sure that before we do anything, we do have that testing in place, the capacity to do the testing. But in addition, as important, we need to make sure we have the capacity to do the contact tracing that will be necessary when a case appears somewhere, so we can actually swoop in there and find out who all the contacts were, isolate as appropriate. That's going to be as important as the testing.
So you are working with the World Health Organization, aren't you, to coordinate the response in Europe? What sort of areas are you looking at?
Well, we are trying to learn the lessons from what different countries are doing. This is a very rapidly evolving situation, and we're learning all the time. For example, one of the areas in which we've been learning about is how to treat people who are seriously ill, and that's been a discussion that's been going on with colleagues in WHO in the last 2 days. But in particular, it's a matter of documenting what other countries are doing. We have created a website where you can look at in detail the responses that different countries are doing, so we can learn from that. Then that needs to be combined with other data by the modelers. And again, colleagues at the University of Washington are doing that, making sure that everybody is talking to one another. So that we can learn lessons. What we've done, we have done some work looking at changes in mobility and how they've been influenced by different policies that have been implemented. What that shows, which is really interesting, is that the population was ahead of the politicians in virtually all countries. So by the time countries introduced restrictions, typically the mobility as measured by various apps, had already fallen by 40 or 50%. And I think that's going to be a consideration as we move out of the restrictions, because I suspect, as others have said, that we may not find people particularly willing to go into crowded places for quite some time.
Fascinating. So how do you think the restrictions, when they are lifted, how do you think that they will be, how will they affect the way in which we live? Do you think it's going to be some time before we get back to living what most people would regard as a normal life?
Well, there is a question to be asked as to whether we will ever get back to the situation we had before, because I think this is causing countries to reassess the whole process of globalization. The whole people are learning that you can have meetings without getting on a plane and travel elsewhere. I think in the short term, however, one of the things that will happen is that we'll see social distancing for quite some time to come. And I think also the evidence of wearing masks is changing all the time. And in a way that Czech Republic, Austria, Morocco, a number of other countries are now making it mandatory. to wear a mask when you're out in public. I think that is going to become quite widespread because the evidence is now accumulating quite substantially that you're not wearing a mask to protect yourself, but to protect other people. So therefore it would have to be mandatory. I think that may be the most obvious change that we see in the short term. But in the longer term, then in the paper that we wrote recently in Nature Medicine, we looked at the economic consequences. And there, I think there are lots of ways that life could change for the better, as President Macron said yesterday when he said, out of this crisis, there is a chance of doing something different, or sadly for the worse. And you will be aware of the debates about surveillance and privacy and so on. But also remember that out of every crisis, there are people who try to exploit it. And there is a danger if we don't do what we're doing in the UK, and I'm glad that the Chancellor is doing what he is doing, of keeping people in jobs, paying them, then there is a danger that the family companies, the small shops, the cafes, and so on, could easily go out of business and be swept up by the multinational corporations. So you have, high streets that are full of nothing but McDonald's and KFC and Dunkin' Donuts, and that would be a shame as well. So we could see lots of changes coming about.
OK, we're going to have to leave it there. Very good to talk to you. Thank you so much, Professor Martin McKee from the London School of Hygiene and Tropical Medicine.